From the ancient rituals of Mesoamerican shamans to the counterculture movements of the 1960s, psychedelic mushrooms have long captivated the human imagination with their profound and mysterious effects. These fungi, revered as sacred sacraments, have been used for millennia in spiritual and healing practices. The Aztecs referred to them as Teonanacatl, or flesh of the gods, employing them in religious ceremonies to connect with the divine and gain insights into the nature of existence. Fast forward to the mid-20th century when Western researchers and psychonauts rediscovered these potent substances, sparking a scientific and cultural revolution that sought to unlock the therapeutic potential of psychedelics. Despite the subsequent decades of prohibition and stigma, recent years have witnessed a resurgence of interest and research, revealing the transformative capabilities of psychedelic mushrooms in treating mental health disorders. This renewed exploration melds ancient wisdom with cutting-edge science, promising a new era of understanding and healing. Exploring the use of psychedelic mushrooms through the lens of triadic relationships provides a structured approach to understanding their complex impacts on neuroplasticity and mental health. By examining various triads, coexistence, equilibrium, reinforcement, feedback, causal reversion, non-linear, retrospective, and more, we can uncover the intricate interplay between these elements. These triads highlight both the potential benefits and risks associated with psychedelic mushroom use. Positive triads, such as coexistence and reinforcement, reveal how proper use can enhance neuroplasticity and mental health, promoting overall well-being. Negative triads, like equilibrium and feedback, demonstrate the adverse effects of misuse, leading to cognitive decline and emotional instability. By analyzing these relationships, we gain valuable insights into the conditions that support therapeutic use and the dangers of improper use. This framework underscores the importance of responsible use, guiding the integration of psychedelic mushrooms into therapeutic practices to maximize mental health benefits while minimizing risks. The coexistence triad involving psychedelic mushrooms, neuroplasticity, and mental health highlights a synergistic relationship where each element positively reinforces the others. The proper use of psychedelic mushrooms can enhance neuroplasticity, which in turn supports improved mental health. This positive interaction leads to an elevated state of consciousness, where the mind is more flexible and adaptive, contributing to overall well-being. Dr. Robin Carhart-Harris states, psychedelics can promote neuroplasticity, allowing the brain to reset and establish healthier patterns. Dr. Carhart-Harris's research has demonstrated that psychedelics like psilocybin can enhance neuroplasticity, the brain's ability to reorganize and form new neural connections. Studies conducted at Imperial College London have shown that psychedelics can reduce activity in the brain's default mode network, DMN, which is associated with self-referential thoughts and the sense of self. This reduction in DMN activity allows for increased connectivity between different brain regions, promoting cognitive flexibility and the potential for therapeutic breakthroughs in treating conditions such as depression and anxiety. This neuroplasticity facilitates the development of healthier thought patterns and emotional responses, contributing to improved mental health. In contrast, the equilibrium triad presents a scenario where the misuse of psychedelic mushrooms leads to impaired cognitive function and poor mental health. This negative interplay results in cognitive decline, where mental capacities deteriorate. The misuse disrupts the balance, leading to a state of diminished awareness and mental health. Dr. Matthew Johnson argues the misuse of psychedelics can lead to adverse mental health outcomes, including impaired cognition and increased risk of mental disorders. Dr. Johnson's research at Johns Hopkins University has explored the risks associated with psychedelic misuse. His studies indicate that unregulated and frequent use of psychedelics can lead to persistent alterations in cognition, including memory impairments and executive function deficits. These cognitive impairments are often accompanied by heightened anxiety, paranoia, and other psychiatric symptoms. Johnson emphasizes that while psychedelics have therapeutic potential, their misuse can exacerbate mental health problems and lead to the development of substance use disorders, highlighting the importance of controlled therapeutic contexts for their use. The reinforcement triad demonstrates how the proper use of psychedelic mushrooms can lead to therapeutic outcomes and enhance patient well-being. This relationship promotes the integration of these substances into therapy, resulting in a positive cycle where therapeutic practices and patient health reinforce each other. The mushrooms serve as a catalyst for beneficial therapeutic processes, improving overall mental health. Dr. Roland Griffiths says, when used appropriately in a therapeutic setting, psychedelics can be powerful tools for healing and personal growth. Dr. Griffiths' pioneering work at Johns Hopkins University has shown that psychedelics, when administered in a controlled therapeutic setting, can lead to significant and enduring improvements in mental health. His research on psilocybin-assisted therapy for depression and anxiety in cancer patients has revealed that a single high-dose session can produce profound mystical experiences that correlate with long-term reductions in anxiety and depressive symptoms. These therapeutic outcomes are often attributed to the sense of interconnectedness and enhanced emotional processing facilitated by psilocybin, supporting its use as an adjunct to psychotherapy. Conversely, the feedback triad shows the detrimental effects of misuse, leading to addiction and life instability. This creates a destructive cycle where negative outcomes perpetuate further misuse and instability. Instead of contributing to well-being, the misuse of mushrooms undermines stability and health, reinforcing a harmful feedback loop. Dr. Nora Volkow states, substance misuse, including psychedelics, can lead to a cycle of dependency and deteriorating life conditions. Dr. Volkow, as director of the National Institute on Drug Abuse, NIDA, has highlighted the dangers of substance misuse, including psychedelics. While classical psychedelics are generally considered non-addictive, their misuse can still lead to psychological dependency and a pattern of escapism. Volkow's research emphasizes that repeated misuse can disrupt personal and professional responsibilities, leading to instability in various aspects of life. Furthermore, the potential for harmful interactions with other substances and pre-existing mental health conditions necessitates caution and regulation in the use of psychedelics outside of supervised therapeutic contexts. In the causal triad, the proper use of psychedelic mushrooms activates serotonin receptors, which leads to mood improvement. This process is anchored in the serotonergic system, where the mushrooms enhance the brain's chemical balance, promoting positive emotional states. This causal relationship highlights the beneficial effects of controlled and therapeutic use. Dr. David Nutt argues psychedelics act on the brain's serotonin system, leading to profound changes in mood and perception. Dr. Nutt's research at Imperial College London has focused on the mechanisms by which psychedelics like psilocybin exert their effects on the brain. Psilocybin is known to be a partial agonist of the 5-HT2A receptor, a subtype of serotonin receptor. Activation of these receptors leads to increased release of serotonin and enhanced neural plasticity, which are thought to underpin the mood-enhancing and perceptual changes observed during psychedelic experiences. Clinical trials led by Nutt have shown significant reductions in depressive symptoms in patients treated with psilocybin, attributed to these neurochemical and neuroplastic changes. The reversion triad, on the other hand, illustrates how misuse can lead to emotional disturbances and a lack of insight. This negative pathway results in regressive behavior, where cognitive and emotional functions deteriorate. Misuse disrupts the balance of the serotonergic system, leading to adverse mental health outcomes and a regression in emotional stability. Dr. Charles Grob says, improper use of psychedelics can exacerbate emotional instability and hinder cognitive clarity. Dr. Grob's research at UCLA has investigated the psychological risks associated with psychedelic misuse. His findings suggest that unsupervised or frequent use can lead to adverse emotional and cognitive effects. These include increased anxiety, paranoia, and a phenomenon known as hallucinogen persisting perception disorder, HPPD, where users experience prolonged visual disturbances and emotional dysregulation. Grob's work underscores the importance of set and setting in psychedelic use and highlights the potential for psychedelics to worsen pre-existing psychiatric conditions if used improperly. The non-linear triad reveals that the proper use of psychedelic mushrooms can produce short-term psychotropic effects that lead to long-term psychological benefits. This relationship underscores the importance of therapeutic sessions, where immediate experiences are harnessed for lasting mental health improvements. The mushrooms act as a tool for achieving sustained psychological growth through carefully guided sessions. Dr. Michael Mithoefer concludes, The acute effects of psychedelics can catalyze lasting changes in mental health when integrated into therapy. Dr. Mithoefer's clinical trials with MDMA-assisted psychotherapy for PTSD have provided valuable insights into the long-term benefits of psychedelics. His research suggests that the intense, short-term psychotropic effects of psychedelics can facilitate breakthroughs in therapy by enabling patients to access and process traumatic memories more effectively. This process often leads to significant reductions in PTSD symptoms, which can be sustained for months or even years after treatment. Mithoefer's work demonstrates the potential for psychedelics to serve as powerful adjuncts to traditional therapeutic approaches, leading to enduring psychological improvements. In the retrospective triad, misuse causes psychological distress and anxiety, leading to mental health deterioration. The negative impact of misuse disrupts mental stability, resulting in long-term harm rather than benefit. Instead of facilitating growth, misuse triggers a decline in mental health, emphasizing the importance of controlled use within therapeutic contexts. Dr. Rick Strassman warns, misuse of psychedelics can lead to anxiety, distress, and long-term mental health issues. Dr. Strassman's research, particularly his studies on DMT, has highlighted the potential risks of psychedelic misuse. His findings indicate that high doses or frequent use can provoke intense and overwhelming experiences, leading to psychological distress. Persistent anxiety, flashbacks, and exacerbation of underlying mental health conditions are potential long-term consequences. Strassman's work underscores the necessity of careful dosing and monitoring, as well as the importance of using psychedelics within a structured and supportive environment to mitigate these risks. The inclusive triad shows how the proper use of psychedelic mushrooms can foster self-reflection and personal growth. This positive dynamic is well integrated within psychotherapy, where the mushrooms enhance introspection and emotional development. The process supports personal transformation and psychological enrichment. Dr. Stanislav Grof claims psychedelics can facilitate deep introspection and significant personal growth. Dr. Grof's extensive research on LSD and other psychedelics has shown their ability to induce profound states of self-reflection and personal growth. Grof's work in the field of transpersonal psychology suggests that psychedelics can help individuals confront and integrate unresolved psychological issues, leading to greater self-awareness and emotional healing. His therapeutic approach, known as holotropic breathwork, combines controlled breathing techniques with psychedelic experiences to promote deep introspective journeys and personal transformation. Conversely, the exclusive triad highlights the negative consequences of misuse, leading to social isolation and depression. Misuse fosters a state of isolation, where the individual becomes increasingly detached from social and emotional connections. This negative dynamic undermines mental health and emphasizes the risks associated with improper use. Dr. George Greer says improper use of psychedelics can result in social withdrawal and depressive symptoms. Dr. Greer's research with the Hefter Research Institute has examined the negative outcomes associated with improper psychedelic use. His studies indicate that misuse, particularly in unsupervised or recreational contexts, can lead to social withdrawal and depressive symptoms. This is often due to the profound and sometimes unsettling nature of psychedelic experiences, which can be difficult to integrate without proper support. Greer's findings highlight the importance of guided therapeutic use to avoid these adverse social and emotional consequences. The conjoined triad demonstrates that mindfulness, when combined with the use of psychedelic mushrooms, can enhance emotional resilience, promoting holistic healing. This relationship supports comprehensive well-being, where mindfulness practices are augmented by the therapeutic effects of mushrooms, leading to greater emotional stability. Dr. Richard Davidson argues, integrating mindfulness with psychedelics can enhance emotional resilience and overall well-being. Dr. Davidson's research at the University of Wisconsin-Madison has explored the synergistic effects of mindfulness practices and psychedelics on emotional resilience. His studies suggest that mindfulness meditation can enhance the therapeutic effects of psychedelics by promoting present moment awareness and emotional regulation. Davidson's work shows that combining these practices can lead to greater psychological flexibility and resilience, helping individuals to better cope with stress and adversity. This integrative approach supports comprehensive well-being and long-term mental health. The bottleneck triad, however, shows that misuse and resulting cognitive impairment can lead to decreased functionality. This negative dynamic results in dysfunction, where mental capacities are compromised and daily functioning deteriorates. Misuse creates a bottleneck, limiting mental and emotional health and emphasizing the importance of responsible use. Dr. Torsten Passy warns the misuse of psychedelics can impair cognitive functions and reduce overall daily functionality. Dr. Passy's research at Hanover Medical School has focused on the cognitive risks associated with psychedelic misuse. His studies indicate that high doses or chronic use can lead to impairments in attention, memory, and executive functioning. These cognitive deficits can interfere with daily activities and professional responsibilities, leading to decreased functionality. Passy's work emphasizes the need for careful dosing and medical supervision to avoid these detrimental effects and ensure that psychedelics are used safely and effectively. In the harmonic triad, the combination of psychedelic mushrooms and cognitive flexibility leads to stress reduction. This relationship fosters adaptive coping mechanisms, where the mushrooms enhance the brain's ability to manage stress effectively. The dynamic supports mental stability and resilience. Dr. Rosalind Watts states, psychedelics can increase cognitive flexibility, helping individuals manage stress more effectively. Dr. Watts's research at Imperial College London has investigated the role of psychedelics in enhancing cognitive flexibility and reducing stress. Her studies have shown that psychedelics can help individuals break free from rigid thought patterns and adopt more adaptive coping mechanisms. This increased cognitive flexibility is associated with a reduction in stress and anxiety, as individuals are better able to navigate life's challenges. Watts's findings highlight the potential for psychedelics to support mental health by fostering more resilient and adaptive cognitive processes. The dissonant triad, in contrast, shows how misuse can lead to psychiatric disorders and interpersonal conflicts. This negative interplay results in chaos, where mental and social stability are disrupted. Misuse creates a dissonant environment, highlighting the potential for significant harm. Dr. Brian Anderson states, improper psychedelic use can exacerbate psychiatric conditions and create significant interpersonal conflicts. Dr. Anderson's research at UCSF has examined the negative interpersonal and psychiatric consequences of psychedelic misuse. His findings suggest that unsupervised use can exacerbate pre-existing psychiatric conditions, such as schizophrenia and bipolar disorder, leading to increased symptoms and instability. Additionally, the altered perceptions and behaviors induced by psychedelics can strain relationships and create interpersonal conflicts. Anderson's work underscores the importance of proper screening and supervision to mitigate these risks and ensure safe use. The convergent triad reveals that the proper use of psychedelic mushrooms can lead to insightful experiences and psychological healing. This relationship fosters transformative experiences where mental health is significantly enhanced through guided use. The mushrooms act as a catalyst for profound personal growth and healing. Dr. Gabor Mate reminds, psychedelics can provide deep insights and facilitate significant psychological healing when used correctly. Dr. Mate's work on trauma and addiction has highlighted the potential of psychedelics to facilitate deep insights and psychological healing. Mate's approach integrates psychedelic-assisted therapy with a focus on uncovering and addressing the root causes of emotional pain and trauma. His research suggests that the profound insights gained during psychedelic experiences can lead to significant therapeutic breakthroughs and lasting mental health improvements. Mate's work advocates for the careful and intentional use of psychedelics within a supportive therapeutic framework. The divergent triad shows that misuse can lead to a loss of purpose and hopelessness, causing disintegration. This negative dynamic results in the breakdown of mental health, where the individual experiences profound emotional and psychological deterioration. Misuse undermines purpose and hope, emphasizing the risks associated with improper use. Dr. Julie Holland warns, misuse of psychedelics can lead to feelings of hopelessness and a profound loss of direction. Dr. Holland's research and clinical practice have explored the dangers of psychedelic misuse, particularly the risk of existential despair. Her findings suggest that without proper guidance, individuals may experience overwhelming and disorienting effects, leading to a loss of purpose and direction. This can result in feelings of hopelessness and profound emotional distress. Holland emphasizes the importance of structured therapeutic settings to provide the necessary support and integration, preventing these negative outcomes. The combination triad highlights how the proper use of psychedelic mushrooms can lead to emotional breakthroughs and mental clarity, facilitating deep therapy. This positive relationship supports therapeutic depth, where the mushrooms enhance emotional and cognitive insights, promoting healing. Dr. James Fadiman suggests psychedelics can lead to powerful emotional breakthroughs and enhanced mental clarity in therapy. Dr. Fadiman's research on microdosing and full-dose psychedelic experiences has highlighted their potential for facilitating emotional breakthroughs and mental clarity. His work suggests that psychedelics can help individuals access and process deep-seated emotions, leading to cathartic releases and greater clarity in understanding personal issues. Fadiman's studies indicate that these breakthroughs can be highly therapeutic, promoting emotional healing and cognitive insights. His research supports the use of psychedelics as tools for enhancing the depth and effectiveness of psychotherapy. The division triad shows that misuse can lead to erratic behavior and emotional numbness, resulting in fragmentation. This negative interplay disrupts mental and emotional stability, leading to a fragmented state. Misuse undermines coherence and stability, highlighting the dangers of improper use. Dr. Rick Doblin reminds, the misuse of psychedelics can cause erratic behavior and emotional numbness, disrupting mental health. Dr. Doblin's work with the Multidisciplinary Association for Psychedelic Studies, MAPS, has underscored the risks of psychedelic misuse. His research indicates that improper use can lead to erratic behavior such as impulsivity and poor decision-making, as well as emotional numbness or detachment. These effects can disrupt an individual's mental health and daily functioning. Doblin's advocacy for regulated therapeutic use aims to mitigate these risks and harness the positive potential of psychedelics while ensuring safety and efficacy. The association triad demonstrates how the proper use of psychedelic mushrooms can promote behavioral changes and emotional stability, supporting an integrated mental health strategy. This positive dynamic fosters comprehensive mental health, where behavioral improvements are reinforced by the therapeutic effects of mushrooms. Dr. Matthew W. Johnson tells us psychedelics can facilitate positive behavioral changes and emotional stability when integrated into mental health strategies. Dr. Johnson's research at Johns Hopkins University has shown that psychedelics can promote significant positive behavioral changes and emotional stability. His studies on psilocybin-assisted therapy have demonstrated that patients often experience lasting improvements in behavior, such as increased openness, improved relationships, and healthier lifestyle choices. These changes are attributed to the deep emotional and cognitive shifts facilitated by psychedelics, which can help individuals break free from maladaptive patterns and develop more adaptive behaviors. The disassociation triad shows that misuse can lead to mental detachment and a lack of motivation, resulting in alienation. This negative interplay leads to emotional and social isolation, where the individual becomes increasingly detached from their surroundings. Misuse fosters alienation, emphasizing the importance of responsible use. Dr. Charles S. Grob frets improper use of psychedelics can lead to mental detachment and a lack of motivation, causing social isolation. Dr. Grob's research at UCLA has highlighted the potential for mental detachment and lack of motivation resulting from improper psychedelic use. His findings suggest that unsupervised or frequent use can lead to dissociative experiences, where individuals feel disconnected from their thoughts, emotions, and surroundings. This detachment can contribute to a lack of motivation and social isolation, as individuals struggle to engage with daily activities and maintain relationships. Grob's work emphasizes the need for controlled use within therapeutic settings to avoid these negative outcomes. The integration triad reveals that the proper use of psychedelic mushrooms can lead to therapeutic progress and self-awareness, supporting integrated therapy. This positive relationship promotes cohesive therapeutic development, where the mushrooms enhance self-awareness and mental health. Dr. Richard J. Davidson concludes, psychedelics can enhance self-awareness and support significant therapeutic progress. Dr. Davidson's research at the University of Wisconsin-Madison has explored the role of psychedelics in enhancing self-awareness and supporting therapeutic progress. His studies suggest that psychedelics can help individuals gain deeper insights into their thoughts, emotions, and behaviors, facilitating greater self-awareness. This enhanced self-awareness can lead to significant therapeutic progress as individuals are better able to understand and address their psychological issues. Davidson's work highlights the potential for psychedelics to support integrated and holistic approaches to mental health treatment. The disintegration triad, however, shows that misuse can lead to cognitive disorganization and loss of identity, resulting in a breakdown. This negative dynamic disrupts mental coherence and stability, leading to significant harm. Misuse undermines mental health, highlighting the potential for severe negative outcomes. Dr. Robin Carhart-Harris warns the misuse of psychedelics can lead to cognitive disorganization and a profound loss of identity. Dr. Carhart-Harris's research at Imperial College London has investigated the adverse effects of psychedelic misuse, particularly cognitive disorganization and loss of identity. His studies indicate that high doses or frequent use can disrupt normal cognitive processes, leading to disorganized thinking and confusion. Additionally, intense psychedelic experiences can cause a temporary dissolution of the ego, which, without proper integration, can result in a lasting sense of identity loss and disorientation. Carhart-Harris's work underscores the importance of controlled and supportive environments to manage these risks and ensure safe psychedelic experiences. Our exploration of the interactions between psychedelic mushrooms, neuroplasticity, and mental health reveals a complex landscape where the potential for profound therapeutic benefits is counterbalanced by significant risks associated with misuse. When used correctly, psychedelic mushrooms can enhance neuroplasticity, leading to improved mental health and emotional well-being. However, improper use can result in cognitive impairments, emotional disturbances, and social isolation. To maximize the positive outcomes and mitigate the risks, it is crucial to follow best practices like those we've explored here. Appropriate dosing is another critical factor. Following recommended guidelines and starting with lower doses allows individuals to gauge their sensitivity and gradually increase the dosage if necessary. The psychological and physical environment, or set and setting, also plays a significant role in shaping the psychedelic experience. Ensuring a positive, safe, and supportive environment can significantly enhance the therapeutic process. Psychedelic mushrooms should always be used in positive, therapeutic environments. It is best to trip under the guidance of a shaman or other trained professional. This ensures the safety and support necessary to navigate the intense and often transformative experiences that shrooms induce. If your therapist is cool, integrating psychedelic sessions with ongoing psychotherapy enhances therapeutic progress, as the insights gained during these sessions can be processed and applied in a more structured manner. Post-session integration practices such as journaling, therapy sessions, and community support groups are vital for making sense of the psychedelic experience and applying its insights to foster personal growth and mental health. Additionally, incorporating mindfulness practices both before and after psychedelic experiences can help ground the individual and promote long-term benefits by fostering emotional resilience and cognitive flexibility. Screening for mental health conditions before starting psychedelic therapy is crucial, as certain psychiatric conditions like psychosis, bipolar disorder, or severe anxiety can be exacerbated by psychedelic use. Know thyself. In conclusion, psychedelic mushrooms have the potential to revolutionize mental health treatment. A balanced, respectful approach that prioritizes safety, support, and ongoing therapeutic integration can ensure that the profound effects of psychedelics contribute positively to mental health and overall well-being.